Welcome to It's Your Case, presented by VetCT.com. I'm Lucy Meehan, I'm your radiologist on demand for this week. So today's case is a 4-year-old Thoroughbred Mare who has been noted to be mildly right hind limb lame with a swelling of the tarsocrural joint. So I hope by this point you've all systematically looked at your x-rays and generated your own reports. I'm going to highlight the most important findings that I think are relevant in this case and hopefully discuss some of the more common manifestations of this disease. So on the screen at the moment we've got a lateromedial and to the left of the screen and a dorsomedial plantarolateral oblique view. The views are centred on the tarsus. They're relatively well exposed, relatively well centred. The main pathology that we see on these two views is a small osseous fragment, which we can see just here, just distal to the distal intermediate ridge of the tibia. You can see that on the distal intermediate ridge of the tibia, we have a small subchondral bone defect, which corresponds nicely to the small osseous fragment that we see distally. So this is consistent with an osteochondritis dissecans fragment or an OCD fragment, and the distal intermediate ridge of the tibia is quite a common place for these. If we look at the other tissues, so we've got the soft tissue margin here, and that is bulging slightly more than I would expect. So it's bulging out. I'd normally expect this curvature to be straight, this to be straight, but this is actually curving dorsally more than I would expect. So that is centered around the tarsocrural joint, and that would fit to me with a tarsocrural joint effusion, and we commonly see those in association with with OCD fragments of the distal intermediate ridge of the tibia. There are a few other findings in this horse. So if we just go to the right dorsoplantar view, which we can see here, one of the other common sites for OCD in the tarsus is the medial malleolus, which I'm just tracing now with my mouse. This should be nice and smooth and regular in outline, and you can see it's just a tiny bit irregular, especially just here where it's superimposed over the talus. That can be a region where you'll get an OCD fragment, and I wouldn't like to rule it out totally based on this view. I can't see a clear fragment if I zoom in here, but we have just got a little notch and indentation there. So what I've said in the report is that there may be a fragment associated with, or maybe an OCD lesion associated with this medial malleolus. If we wanted to check that out more thoroughly, we could take some more views. So we could angle 10 degrees further laterally and hopefully project the medial malleolus away from the talus there, or we could do an ultrasound of that region and see if we can find a fragment there. So that's something else that we need to look at. It would be unusual for a horse to have two sites of OCD in the same joint, however, not impossible. So it is just important to be aware of the other sites of OCD. The other findings that are of interest here in this horse, you can see again on this dorsoplantar view, there's just a small amount of periarticular new bone formation just associated with the distal intertarsal joint here. Just a slight bit of irregularity. I've said in the report that I think that's probably clinically insignificant. However, it's something to note and may need monitoring. There is a little bit of superimposition here on the dorsal aspect of the tarsometatarsal joint, and it could be interpreted as an osteophyte. However, I suspect that's probably within normal limits, so I wouldn't worry too much about that. The other thing to note, and I've written this in the report if you've read the report, that OCD is often a multi-joint disease. It's a systemic disease, a systemic developmental disease, and there are often other joints affected. So I would personally recommend that this horse has the left tarsus x-rayed, and also that that the clinician examines carefully the other joints that may have predilection for OCD, so the fetlocks and the stifles, and the radiographs of those are completed if that's deemed necessary. So be sure to read the full report that's associated with this case. Thanks for listening, and please remember it's your case. So if you do have any questions, please post your questions on the social media site and we'll get back to you as soon as we can.